indications that COVID-19 is making a comeback after months of falling cases. According to the Centers for Disease Control and Prevention, hospitalizations have been trending upwards since the beginning of July, the first increase seen this year. We want to take a closer look, though, at what's happening in Central Texas. Dr. Scott Clitheroe with the Travis County Medical Society joins us for insight. Dr. Clitheroe, thanks so much for being here.
It's my pleasure.
Okay, let's add a little context first here. The U.S. has experienced increases in COVID-19 during the last 3 summers. So the CDC says this spike isn't too surprising. What, though, are we seeing in our local hospitals as it relates to COVID?
Cases have been very low in the hospital. So luckily, the patients that are getting in, and we certainly have seen an uptick in positive diagnoses of COVID and in the wastewater monitoring, that there hasn't been as many admissions here. And that, I think, is a sign that the community is well vaccinated and protected overall. And a sign, I think, that the medical community here in Austin is treating patients appropriately when they do get COVID.
Okay, so when people get it, what symptoms are they seeing? I'm hearing that they think maybe it's just allergies, but then it ends up being COVID-19. So what are the symptoms? How can they differentiate between the two?
They are very similar. You know, we know that sore throat has been quite a common symptom in the latest variants. Of course, the loss of smell and the loss of taste or taste sensation changes is also maybe a differentiator, but it is somewhat hard to tell. Cough, congestion, runny nose, things like that. And, you know, it still is important to get tested if you have any concern.
Okay, so it is good that we're not seeing a lot of hospitalizations. What are the factors that play into the surge that we're seeing now? Do we have any concerns about the fall?
Well, they may be unrelated. I mean, there's been a lot of experts that tell us in the medical community to expect a surge in the fall and the winter, as there has been. And there has been this also summer surge that we've seen. And I think it'll take years to understand exactly the biology of this virus and to know exactly why it has a little surge in the summer. Of course, we all know in this part of the world, as y'all mentioned earlier, it's very hot outside. And so we're spending a lot of time inside now, maybe more than we do other times of the year. And also, this is a time of travel. And of course, when you travel in planes and just are around other people, you're more likely to get the virus.
Okay, and I'm glad that you brought up travel. Would you advise people to change their behavior now? Is there something that we should do to protect ourselves?
I would not avoid travel, but if you are at risk of getting severely sick, which would be somebody who's of advanced age or has immune suppression for whatever reason or has multiple medical issues, you should protect yourself, which means wear an N95 mask while you're in a plane or in the airport. Things that we talked about during the emergency, I think still apply. And I know that some people feel like we've kind of moved on from the virus, but there are still people dying of this virus every day. And the majority of them are the folks that are at risk.
Okay, Dr. Clitheroe, thank you so much for the helpful information and for joining us this afternoon.
It's my pleasure. Thank you.